Hi. Um, Today, I would like to start a review of an amazing book, which I started reading uh, recently. And I'm still in the process of finishing it and digesting all the scientific information, all the amazing information in this book. I would start reviewing this book, and I highly, highly recommend that you all read it because I can just relay my understanding of the book, and I believe it's very important that you personally read it and digest it on your own. The book is called When the Body Says No by Dr. Gabor Mate. And it states in the title of the book that is exploring the stress disease connection. And in fact, Dr. Mate was incited to write this book when a counselor at British Columbia Cancer Agency asked him to investigate the role of emotional repression in cancer. Dr. Peter Levine, who is another wonderful trauma therapist, Dr. Mate is not by education, is not a trauma therapist. He's a retired general practitioner or primary care physician, but through his own studies and working on his own childhood trauma and helping other people, especially people in hospice, people in palliative care, addicted people, by helping them to resolve their childhood trauma, has raised to become one of the most amazing trauma specialists in the world, even though you cannot directly get really treated by him. He is a bestseller author, was in a recent movie, The Wisdom of Trauma. I hope you all watch it. And is basically very busy doing other stuff, but his method of treatment called compassionate inquiry, he is constantly teaching it to therapists, to doctors, social workers, whoever is dealing with people with trauma, which I guess is everybody. And it's a one-year course that someone can take in order to be able to offer his method of treatment for trauma to their patients. I took a self-study brief course about it just to learn about it, not to become a therapist in compassionate inquiry. But through dealing with my own traumas, obviously I have learned of trauma specialists, and one of them is one of the very good ones, in addition to Dr. Gabor Mate, is Dr. Peter Levine, whose method of treating trauma is called somatic experience, or SE. And again, just like Dr. Mate's method, therapists or doctors, whoever wants to deal with trauma patients, they need to take that course and get certified in somatic experience, just as people need to get certified for compassionate inquiry. But Dr. Peter Levine has written something about this book, and on the page of the cover of the book, basically Dr. Levine says, this is a most important book, both for patient and physician. It could save your life. I'm getting goosebumps by saying that, but it can. So before I start, as Dr. Mate has emphasized in his books, I am emphasizing that neither his intention nor mine is to blame anybody, blame the patient. The last thing that patients need is to feel blamed. They're often confused about why they got cancer to begin with. Many of them have healthy lifestyle. They're exercising, they're eating well, they're doing everything they know and possible to be healthy. Nobody wants to get sick. And when they are shocked by the diagnosis of cancer, often the first question is, why me? I was doing everything right. Why me? What did I do to deserve this? And this book is an attempt really to answer that question. And when this book points to childhood and adulthood trauma as the underlying cause of many diseases, including cancer, multiple sclerosis, ALS, Crohn's disease, many autoimmune diseases, you name it. When Dr. Mate is scientifically showing that there's a link between these two, what is he's attempting to do, and what I am attempting to do by basically sharing what I've learned from his book, is to empower you. Because as long as you don't know why you got it, there's nothing you can do about it, right? So an average cancer patient is entirely dependent on the external treatments they're receiving, whether it's surgery or chemotherapy or radiation therapy. They're feeling otherwise helpless because they just say, well, there's nothing I can do. Tell me what to do. Okay, you need surgery. Okay, I guess I get surgery because I don't have any other option. I don't know why I got it. So, okay, you need radiation. Okay, if you say so. Chemotherapy. Okay, if you say so. Because there's really no other alternative on the surface. But when somebody like Dr. Gabor Mate tells you, you need to pay attention to your childhood trauma, your adulthood trauma, your emotions, your stressors in your life, because they have something to do with this, then there's something you can do. You can explore. You can start healing your trauma. You can even change. You need to change. You need to change your emotions. You need to change your responses to stressors in your life. And that applies to me too. When I say you, that includes me. We need to do that because it's associated with all kinds of diseases. So what has happened as a result of our childhood trauma, adulthood trauma? We have developed some maladaptive skills or responses to our environment, to people in our life, to society as a whole. And these maladaptive skills have made us who we are. It has led to our personalities. Which is our personal reality, as Dr. Joe Dispenza calls it. So by studying our responses to external stimuli, stressors, by changing our emotions, by dealing with our emotions, with learning a healthy way of responding rather than our maladaptive responses or reactions. Really, they're not response, they're reaction. You get triggered and you react like a knee-jerk response. You don't even think about it. It's just unconscious. You have been doing this for all of your life since you have been a child. And therefore, it has become an automatic reaction rather than a thoughtful response. Something that you explore and say, okay, how am I going to respond to this? What is the healthy way of responding to this? Instead, we have our trigger points and boom, 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 put us in the same situation and we constantly react the same way. So a psychologist named Dr. Ross Bach has divided our emotional responses into 3 categories. Emotion 1, as he calls it, is our physiologic response to a stimulus. Emotion 2 is display of our emotions in response to something. That is how other people see how we are responding or reacting to a stimulus. And then emotion 3 is our subjective emotions, our subjective experience. So to give you an example, something may happen in my environment that makes me feel sad. That is emotion 3. I'm feeling subjective, I'm feeling sad. My objective display of my emotion depends on my traumas. Because if, as a child, I was conditioned not to show sadness because sadness was considered a negative emotion, a useless emotion, something that doesn't help you feel sad. Just get yourself up and feel happy. If my sadness was not validated, there was no space for receiving my sadness. There was nobody there to hold space for me as a child to experience sadness and sit with me and validate it and help me through it. Then I may develop a maladaptive response by hiding my sadness, because I feel that it wouldn't be perceived well. I wouldn't get a positive response from whoever is around me, whether it's my friend or my family or my employer or whatever, society as a whole. Therefore, I put a fake smile on my face. And while I'm deeply sad, the face I present to the outer world is that I'm fine. I'm in fact, I'm happy. I'm smiling. Look at me, I'm smiling. Unfortunately, or fortunately, we cannot fool our physiology response, our bodily response. When you feel sadness, there is a consistency between emotion 1 and 3. That is, if you feel sad, your body responds to sadness. Your body is not going to respond to your fake smile. That's really a very important point to consider. Basically asking yourself, how do I display my emotions? Do I even allow myself to feel it? or I immediately switch to something to distract me, whether it's TV or whether it's eating or whether it's smoking or whatever skills or ways I have learned in my life, go shopping or whatever, do exercise to death, whatever maladaptive way we have learned to hide our genuine subjective emotions and portray a different picture, a picture that society is expecting to see. But our body and our physiology is in coherence with the way you're feeling, your vibrations, and not with the fake smile we are putting on our face. So we live in a society, and when I say we are living in different geographical areas. People are from Canada, from Australia, from Europe, from US, Middle East, whatever. And there are some cultural differences in the way society perceives display of emotions. But I'm talking about really basically Western or US. That's where I have been for more than 27 years. That's where I practice as a physician. What is expected of us is that we keep a cool head, cool. You're cool people. And what does cool mean? Cool really means absence of emotions. They don't want to see your emotions. They even tell you, don't be so emotional, don't be so sensitive, as if this is something really bad. It's not allowed. So what happens is we shut down. We cover our emotions. And this shutdown is serving the purpose of not feeling rejected or ashamed because society doesn't accept those kind of emotions. As a result, even though this is an attempt to protect ourselves, but what really happens is that our emotional competence is compromised. And that means that more and more we become people who do not know how to effectively handle the feelings and desires when dealing with the world. And in some ways, especially for children, it's a form of helplessness. Because if you can't talk about your emotion, if you can't ask help, or if your emotions are not validated, then you're in a state of helplessness. As a child, you're not equipped to handle sadness or anger. These are behaviors that we learn. And only when our parents are holding space and validating our feelings and talking to us, teaching us what is the constructive or healthy way of dealing with anger. If we are not seen or heard or felt, and therefore we wouldn't be emotionally competent people. And this helplessness is a form of learned helplessness. You weren't born like that, but now you have learned that because of the way your parents or your surrounding responded to you, and you as a sensitive child, emotional child, which is nothing wrong with it, then this is a learned helplessness. And that is what results in repeatedly creating similar scenarios in our lives. If we were in an abusive household, if we were in a very detached and disconnected environment, we recreate those things in our adulthood. And then we will feel stuck in abusive relationships, dysfunctional relationships, stressful jobs, and basically don't have any true freedom. We don't have freedom because none of these things we are doing consciously. We are doing all of this unconsciously. And over find ourselves in the same situation and keep asking ourselves, what happened? Why am I again in an abusive relationship? Because you didn't really consciously choose that. It was an unconscious choice you made, which was based on your traumas. For emotional competence, what we need is self-regulation, meaning that we have to be able to sit with whatever emotion we're feeling. And we have to develop the ability to deal in an appropriate, satisfactory way that is good for your own feelings and desires. Because often when society wants to teach us how to deal with our feelings, it completely disregards our feelings. What it matters to, for example, you're not supposed to take your emotions to work, right? Who is being served here? Your employer, right? Because they want a cool, always happy employee, so they can do their job without any disruption and therefore make money for the employer or whatever society needs us to be so they can continue to be the dysfunctional society that they are. They don't really value our authentic emotions and feeling. And being emotionally competent is really to deal with your truest feelings and emotions in a healthy way. Emotional competence requires feeling our emotions, not running away from them. It requires that our emotions remain pertinent to present situation, and it is not representation of some residual from the past, which is usually the case. When you get triggered, the meaning of trigger is that something from the past is still so sensitive and sore. It's such an open wound that somebody touches it and you're boom, you're triggered. That is the hallmark of residual from the past. As opposed to somebody who has been able to deal with their past traumas and emotions, feel them, heal, and then they respond to present moment instead of constantly reacting to their past. In fact, I remember Dr. Gabor Mate was talking about psychedelics. He has done it himself, and he has been somebody who holds space for other people to go through this experience. And I remember in one of his talks, he was saying that I was in a ceremony with 4 or 5 other people, and there were some of them like were there because of addiction. And said that like in the middle of the night, the shaman came to me and said, I know what trauma is. I just realized what trauma is. And Dr. Gabor asked, okay, so what do you think trauma is? And he said, trauma is disconnection from the present moment. Because we're constantly responding based on our past experience, past unresolved experiences. The other thing that emotional competence requires is awareness of your genuine needs. They need to be loved, they need to be respected, they need to be seen, they need to be heard, they need to take care of yourself, which we often deny all of that to ourselves. and instead are constantly taking other people, paying more attention to how people around us are going to feel if I did that, or I feel sad, or if I didn't smile or cry, how they are going to respond to me. Are they going to reject me? Am I going to be abandoned? So that is an unhealthy concern. You have to be concerned about your own genuine feelings and needs. And what we call stress, which is the underlying cause of many of diseases, including cancer, is the absence of the above criteria. So the stress happens when we are not emotionally competent. So in dealing with stress, we have a stress stimulus, or it's called stressor. There's something out there that happens. And as opposed to what we may think, Dr. Mate says, and a lot of trauma experts say, that this stressor or stress stimulant is not a universal stressor, because a stress happens as the way we react or respond to an external stimulus. So if, say, somebody's parent died, and yes, it's a loss, it's sad for everybody, but somebody might have been expecting that, yeah, my 90-year-old parent may die one day. And depending on how they look at death, how they have dealt with death in the past, they may have a much healthier response. They may be sad, but it wouldn't be a prolonged maladaptive response to loss of a parent. For example, adults or children who have had an unhealthy relationship with a parent, when they lose their parent, they lose the opportunity to repair that relationship forever. And that may put them in a deep, deep depression. And so the response is not similar to the response of the first person I just mentioned. So for the first person, it might be a short, acute period of stress that resolves and dissipates. And for the second person, it becomes a chronic stress, something that they're constantly dealing with, it, maybe even for the rest of their life, that they lost the opportunity to repair their relationship with father or mother, whatever, or get an apology for being abused or whatever. So as a result, there's no universal stressor. It's all about how we respond or react to this external stress stimuli. For an animal, for example, and I say that with great appreciation for emotions of animals as well, but for the most part, the lower centers of our body, lower chakras of our body that deal with survivorship, those centers are not quite very concerned about our emotions. It's all about keeping us alive. So if there's a lack of food, that's a huge stressor for animals or the lower chakras of our body, because that is threatening our survival, right? So animals, for the most part, their reaction in any survivor situation, whether a lion is chasing them or there's no food or whatever, those are usually their major stressors. Now, obviously, as we have brought animals into our homes, have pets, dogs, birds, cats, now they are learning a different stressor, and those are emotional stressors. But in comparison between human beings and animal in general, I'm talking about, for human being, the most important stressors are emotional stressors. For example, if somebody is threatened to loss of love rather than loss of breath, their reaction or their response to this stressor is going to be much more significant. The other things that we all have been experiencing in the past year or so as a result of pandemic, studies have shown that uncertainty, lack of information, and loss of control are three major emotional stressors for human beings. So we all have lived through COVID. Some of us didn't, unfortunately, where we are uncertain about our future, whether we can go to a restaurant or whether we can physically go to our job, or what is going to happen to schools, what's going to happen to traveling, or whatever the plans you had. Lack of information, or even worse than that, plenty of misinformation around this subject, and the loss of control. None of us, more than a year ago when COVID happened, knew that we're going to be homebound, isolated, not able to do many of the things that we did, including going to our jobs physically or having social gatherings or whatever we used to do. And we felt that we're in control of it, right? And suddenly this pandemic happens, and we once again are reminded that we really don't have any control, and things are uncertain. There's not enough information. We're just learning about this virus, and every day there's a new variant, and we're learning about the new variants. We're not even sure if, for example, we need a booster for vaccine or not. There's a lot of uncertainty, a lot of lack of information. So no surprise that we are very stressed out because of these three major emotions. And here I want to kind of, before further going into the stress response, talk about our health system. Again, our health systems are different in Canada from US, Australia, and Europe or Middle East. Again, I'm just talking about US. That is where I'm practicing as a physician. When you look at how our health system, healthcare in general, has divided our physical and our mental health, I mean, it's unbelievable. It's unbelievable how anybody could think that our emotions and our bodies are two separate things, have nothing to do with each other. So just looking at the body, when you look at the health coverage or insurance in the United States of America, you see some weird stuff. I, as somebody in the US who has coverage, is lucky enough to have coverage because there are millions of people who don't. I have to have 3 different health insurances. One is for my health. They call it your health insurance. Then I have to have a coverage for my teeth called dental insurance or dental coverage. And then I have to have a third one called vision insurance or vision coverage. Who in the world decided that my teeth are not a part of my body and my health? And who in the world decided that my eyes are a completely different category or organ from the rest of my body? Only in the United States of America. And it has some practical implications. Your primary care physician, say you're in the United States, especially if you have some kind of insurance called HMOs, which requires referral by your primary care physician to a specialist. Your primary care physician is like gatekeeper. He or she knows everything about, or at least attempts to know everything about your body. And then when they refer you to a specialist, whether that is a surgeon or a radiation oncologist or a medical oncologist, they receive a copy of the consultation notes by those consultants. And consultants call, for example, if a primary care physician sends me a patient for radiation, I not only send a copy of my consultation to the primary care physician, but also pick up the phone and call them. And I said, I thank you for your referral. And I saw so-and-so, and this is what is my opinion, and this is what I have recommended. So the fact that all other organs of my body other than my teeth and my eyes, and then we get to the mental health, my primary care physician gets information about everything other than my teeth and eyes, because those are separate insurances. Those are separate specialties. So when I go and see my eye doctor or my dentist, my primary care physician is not getting a copy of their consultation or what they have recommended. There's a fracture, there's a disconnect between my primary care physician, my dentist, and my eye doctor. That can cause problems, because many of diseases in my body, they may show up with a symptom in my eyes. We all know people who have diabetes, they can have problem with their vision. We all know that certain people who have certain heart conditions, every time they go to a dentist and a procedure has to be done, they have to be on prophylactic antibiotics. Otherwise, they get infection of the inner lining of their heart calling it, which is called endocarditis. So who decided that the teeth and the eyes are separate from the rest of our body? Don't ask me. It's all about insurance companies and forcing you to get 3 coverage, pay 3 premiums for eye and teeth and the rest of your body. And when it comes to mental health, you can completely forget about any connection between your primary care physician and your mental health provider, because medicine, Western medicine, has just separated these two forever. I have noticed that during COVID pandemic, as a result of sudden increase in mental health issues, depression, suicide, you name it, especially in younger adults, in everybody, because they have lost jobs, their lives are threatened, they're socially isolated, nothing is like the past, they are very uncertain about future, lack of information, loss of control. So now I have seen in primary care physician notes that they have introduced and implemented a questionnaire about your mental health. And what by mental health, what I really mean is depression, because these questionnaires are really built around depression. They want to, your primary care doctor now wants to know whether you're depressed or not as a result of this pandemic. Before, they wouldn't ask. You would go there for a headache, they wouldn't ask whether you're under stress or not. They would just try to figure maybe you have something in your brain, which could be tension headache as a result of stress. But now, how they deal with the responses you give to that questionnaire is very interesting, because that has not changed. So if they ask, your primary care physician asked about these questions about depression, and turned out that the score was high for depression, and now your primary care doctor thinks that you might be depressed, two things might happen. One is that if they're really busy and they don't want to deal with it, they would refer you to a psychiatrist. You get a referral to go see a psychiatrist. If they are kind of more feeling that, they feel comfortable to prescribe you an antidepressant, then your primary care physician would put you on antidepressants immediately. Because that's how psychiatry looks at mental health. They consider it not a response to the stressor in your life, but they look at it as a chemical imbalance in your brain. And just like somebody who's diabetic and they need insulin because their pancreas is not producing enough insulin, the idea about depression is that your brain is not secreting enough serotonin or dopamine or whatever. Therefore, we're going to put you on a medication. And what is that medication going to do to you and to your brain is going to make it worse. Because if, as a result of pandemic and social isolation and loss of job and all these thousands of stressors at the same time, somebody's healthy response to this situation is to get slightly depressed or feel sadness or anxiety. In the mind of the psychiatrist, they are saying, okay, your brain is not producing enough serotonin. So say you have 15% reduction in production of serotonin as a result of your response to this huge pandemic. Okay, they put you on antidepressants. What do you think is going to happen? The moment they put you on antidepressants, depending on what category it is, or maybe you have problem with sleep, they put you on sleep medication. Depending on what category of medication the medication you're on is, it can further depress or suppress production of serotonin, dopamine, GABA, melatonin. That's how our bodies are. It's even if you go on a laxative for a long period of time, when you come off it, you're constipated because your bowel has become dependent on the laxative. If you are on thyroid hormone for good or bad reason, your thyroid stopped producing whatever it was producing before they placed you on a thyroid hormone. And now you cannot come off the thyroid hormone medication, because if your thyroid was producing 50% of what it was supposed to produce, now it's producing none. And you're completely dependent on the thyroid medication. Same thing happens with antidepressants and sleep medications. That is why there is withdrawal. There's physiological dependency on these medications. When you cannot come off an antidepressants or a sleep medication suddenly, you can die. It's a life-threatening withdrawal, just like drugs. So the way you come off an antidepressants or sleep medication is by tapering it gradually off. So if you're taking 300 milligram of it you go to 250, 200, 150, 150 before, like long periods of time before you can finally come off. And every time you drop the dose of medication from 300 to 250, your brain wakes up like, uh-oh, I'm not getting enough serotonin, I better produce some. And then your brains start producing these things that was suppressed, their production was suppressed while you were on the medications. And as you gradually drop the medication, gradually your brain is producing more and more and more until you come off medication. So they're really not, I mean, I'm not saying antidepressants don't have a role. Yes, somebody is suicidal and, you know, they're gonna be self-destructive. Obviously, for a short period of time, this medication can be helpful. The problem is that I see it over in my patients, that I look at them list, they say, I can bring all medication you're taking. And sometimes I see a patient is on literally 50 different kind of medications. And I ask them, who has prescribed all of this? Oh, I don't know. No, I've been on this for past 15 years. So primary care physician prescribes something, a specialist prescribes something. Nobody is looking at them. In US, the pharmacist is supposed to be the gatekeeper to look at all these medications and see whether they interact with each other, whether they're contraindicated to take with each other. And somebody goes on something and the doctor forgets, you know, patient has been on this antidepressants for past 3 years. And then it becomes extremely difficult to come off it. And when it comes to therapy, it's even worse because, again, within the mental health system, they have divided people by using DSM and constantly labeling people with these terms. Oh, this one is depressed. This is bipolar. This is, I don't know, schizophrenia, whatever, labeling them. And then they decide for you, oh, you have this label, you have to go to a psychiatrist. Oh, you have this label, you have to go to a therapist who is actually a psychologist. Well, the psychologist is not going to write you medication. They are going to make an attempt, depending on how they have been trained, to figure out what is causing your depression or anxiety or whatever, and talk you out of it. The psychiatrist, you can hardly ever in the United States, there are some, but it's very hard to find a psychiatrist who also provides therapy, meaning psychotherapy, that a psychiatrist actually talks to you. They don't do talk therapy. They just write a prescription. You tell them how you're feeling, and they decide what prescription you need. So I guess I would leave discussion of our stress responses to life stressors for the next time. And just wanted to basically show you the absurdity of how our minds and bodies have been divided. Even our mind has been, depending on the label, divided between whether you need talk therapy or need medication, and complete lack of understanding as how our emotions, our stressors, how we respond to them, our traumas are playing such a huge, major role in making us sick. And that is something that we'll continue to explore and we continue to discuss in the upcoming weeks. I don't know how many weeks. I don't plan things like that ahead of time. I just go with the flow. And together, we will review this wonderful book. But as I said before, please read it yourself as well. Don't rely on my sharing my understanding of the book with you. I'm hoping to see you next week. And if you have any question, please email me. You all have my email, and I will send you the recording. Have a great week.